Many women who choose to have children later in life find that they've waited too long and end up needing fertility treatments. But thanks to new advances in reproductive medicine, women can find out what their fertility outlook is long before they want to start a family, which can ultimately save time and money. Here to tell us how these tests work is Dr. Angela Thayer from Seattle Reproductive Medicine and two patients who have just had fertility assessments, Renee Kilberg and Courtney Smith. Thanks for being with us, ladies.
Thank you.
First, Dr. Thayer, tell us, what is a fertility assessment and who should be getting one of these?
Well, a fertility assessment is a way for women to assess their reproductive potential, and we're talking about the aging of the ovary and the number of eggs they have remaining. So if you can gauge your ovarian reserve, you might have a sense of how long you have to get pregnant.
This used to be one of those sort of throw the dart at the board type of things. We knew that there were certain ages where things would start to get a little trickier for us, but this actually sort of definitively tells you?
Well, it's not definitive. You know, the information comes from patients, our patients who are coming in and we're treating. So it's a new application to use these tests for women who aren't yet trying to conceive and then try to give them some prognostic information. So, you know, it's a great option for women who are 30 or older who are wanting to have children at some point, but not right now, and so they're kind of wanting to gauge how long they might have.
And so, Courtney and Renee, why did you decide to have these tests done? You're still young. Why did you choose to do it?
Do you want to start?
Go ahead.
I just have a 5-year plan to where I'll just figure it out in 5 years if I want to have children or not. So this was a really good way to kind of encourage me to make that adult decision sooner in life.
Yeah.
Instead of just keep putting it off.
And you have a big life change coming up soon. Did that sort of play into why you were doing this?
It did. I'm getting married in a couple of weeks, and I want to start grad school after that. And so I'm not sure if I want to have kids while I'm doing grad school or wait. So
yeah,
just puts things in a different perspective.
And doctor, is there a difference between egg quality versus egg quantity that you're looking at in these tests?
Absolutely. These tests are really set up to measure quantity. Quality, we think, is more tied to chronologic age. But the quantity can vary. So somebody who's 30 could have a lower ovarian reserve. Somebody who's 40 might have a lot of eggs, but because they're 40, the quality of the eggs is not going to be as good. So these tests will help us gauge quantity of eggs, and we know in younger patients the quality is still going to be better.
What tests did they have, and how much do these tests run?
So the tests, we have 3 tests we usually do. The first test we do is actually the newest test, and it's called anti-Müllerian hormone, and it's a hormone made by the cells that are around a growing egg and follicle. So, you know, a normal range is 0 to 7, and higher numbers better. And the second test we do is an ultrasound, where we look at the ovary and we're counting the number of small follicles we see. And those are also going to relate directly to somebody's ovarian reserve and their fertility potential in the future. So normal antral follicle count that we're counting should be about 10 to 20 total follicles. And then the third test is actually the oldest test that most people have heard of, which is the day 3 FSH estradiol test, which is measuring the response of the hormones to the ovary in the stimulation in a regular menstrual cycle. And that test has to be done on day 3 of a menstrual cycle, so it's a little bit harder to accomplish. The other tests can be done any day of the month, so those are more flexible for women to get.
And about how much does it run to have one of these tests done?
It runs about $300 to do all the tests and then sit down with one of the physicians to talk about the results.
Certainly far less than fertility treatments that could come in the future.
Absolutely.
So what were the results of your tests?
My results were, not to get into numbers, but I need to make that decision sooner rather than later. Otherwise, I probably will be challenged at 35, like a lot of women are, to have children.
And Courtney?
I was happy with my results. They're fairly average. I'm not concerned with the results.
So it didn't necessarily change your
No.
plans for the future?
No, fortunately, no.
Is this something that you would recommend to other women after your experience?
Yeah,
Absolutely.
yes, definitely. I'm considering doing it next year to see if my results have decreased, and then we kind of discuss my options. If I do decide to have children, I could freeze my eggs or not. So it's something that I find to be really good to plan for the future, because I'm not in any place to have children right now.
It just kind of arms you to make decisions perhaps a little bit better about your life.
That's right, and you can track it over time. So that's great if you're waiting. You can still check next year and see where you are.
Fascinating. Look how far we've come. No more dart at the board anymore
That's right.
necessarily. Well, if you would like to set up a fertility assessment with Seattle Reproductive Medicine, you can get a hold of them through our website, king5.com/newday. We have their contact information there for you, and we will link you to their page. Up next on New Day, it's known as the lazy boy of comfort food. Seattle's top sandwiches revealed. Don't make plans for lunch until you see this. We'll be right back. Thanks for joining us. That was really fun.